invited guests and participants to join. Hello, everyone. We'll just give a couple of minutes for some of our participants to join us. We will be starting shortly. Welcome, everyone. We'll just give another minute. Hello, everyone, and welcome to this webinar on how organizations of persons with disability, otherwise known as OPDs, in Nigeria are keeping people safe. I'm Dr. Eleanor Mwadinobi, and I'm the Senior Advisor of the Nigeria Resource and Support. I'm also a medical doctor, an international health, women, peace and security, gender and human rights expert. I'm currently the president of the Medical Women's International Association. Before we start this webinar, please allow me to share just a few points on housekeeping. First, you are all on mute with your videos turned off. And this really is to support with the quality and connection of the webinar. Please be aware that we are recording this webinar to share on the online hub afterwards for anyone who may not have been able to join us. But be rest assured that your names will not be visible. We will, at the end of the webinar, have a Q&A session. And if you would like to ask any questions during the presentation, you can find the Q&A function in the controls panel at the bottom of your screen. And you can add new questions or upvote any existing questions as we will answer them at the end. We do have closed captioning available, and it's next to the Q&A or record button, and it's got the initial CC, depending on the configuration of your device. We also have sign language interpreters. And today we're looking at the practical application of disability inclusion in safeguarding practices. Let me first of all acknowledge that we have with us today Jo Dempster, who's an independent consultant working with Sightsavers, and she was the research manager for this research, working closely with JONAPWD and the consultant Deji, who you will soon be meeting. She also conducted the first phase of this process, consulting with umbrella bodies and international NGOs working in disability inclusive safeguarding. Now to our panelists. First, you'll be hearing from Jo Feather, who's a principal consultant in the GBV portfolio of Social Development Direct. She co-leads the evidence and research work for Safeguarding Resource and Support Hub, RSH, and in that capacity has supported this research with organizations of persons with disabilities in Nigeria, alongside colleagues at JONAPWD, Site Savers, and RSH Nigeria. We also have Adedeji Ademefun, who's the lead research and author of the report. Deji, as we call him, is a researcher and development expert with experience in managing programs and projects in democratic governance, women and girls' rights, community development, education, food and hunger, rural livelihoods, and the list is endless. We welcome Deji. We also have with us today Ishaku Adamu, who is the JONAPWD Cluster President and was the research lead in Gombe. Ishaku has a bachelor's degree in political science from Gombe State University, Nigeria, and a master's degree in political economy from the University of Manchester, UK. Also, as a panelist today, we have Theophilus Odaudu, Disability Rights Fund, Nigeria. Theophilus is a program officer for the Nigeria for the Disability Rights Fund and Disability Rights Advocacy Fund, with over 10 years experience in working with government and the disability community. Last but certainly not the least, we've got Peter Chidi Uwaje. He's head of finance and administration of JONAPWD. Peter Chidi is a graduate of the Enugu State University of Science and Technology, and he's also got an MBA in banking. Now that you have heard the short bios of our erudite panelists, it's time to hear directly from them. Please go ahead, Jo Feather.
Thank you, Dr. Eleanor. I'm just going to take a few minutes just to introduce the research, but first of all, Sylvia, do we have the slides we can share? For those of you who may not be familiar with RSH, just a very quick introduction on RSH. So we are a consortium of organisations that are funded by the FCDO, with the view of aim of supporting organisations in the international aid sector to strengthen their safeguarding policy and practice against sexual exploitation, abuse, and sexual harassment. Can you just move on to the next two slides, please, Sylvia? So next one, please. So we are a consortium led and managed by Options in the UK and with the technical leadership from Social Development Direct, with a number of organisations that support us. So Translators Without Borders, Tel des Hommes, recently ICFA has joined the consortium, and we also have Site Savers on our consortium, and they were instrumental in supporting this, this research. Next slide, please. So really the sort of, I want to talk to you a little bit about why RSH commissioned research. So we wanted, as a program, to understand how to support organisations of persons with disability to strengthen their approach to safeguarding. As part of our key offer is supporting lesser resource CSOs to strengthen and develop capacity. We needed to understand the needs of OPDs around disability inclusive safeguarding. We wanted to understand what they were currently doing to ensure people are protected from abuse, harm, and violence, and how their programs are ensuring they're not causing any harm. We also wanted to understand the barriers and challenges that exist for both OPDs and the community groups with whom they work. There were a number of principles guiding the research. Next slide, please. And one of them really was to sort of work to think about how we could directly involve persons with disabilities to help us understand and define the ways in which they feel safe and identify the ways in which they wish to be protected. We wanted to speak directly to persons with disabilities to understand what their barriers were. Next slide, please. The research had 5 research questions really to reflect on our objectives. And Deji is going to talk you through the findings under each of those research questions. Next slide, please. So just briefly to talk a little bit about the process. So Dr. Eleanor mentioned that we had Joe Dempster, a consultant from Sightsavers, who conducted a first phase of consultation with international NGOs and umbrella bodies, OPD alliances, to really understand some of the current practices and gaps. And that led to us designing this research that we wanted to happen directly in one of our country hubs, and to really involve and support OPDs and speak to persons with disabilities directly. And that led to this design of the research. We then put out an invitation to tender, and we identified a number of OPDs and umbrella organisations within Nigeria and invited them to submit a proposal. And we selected JONAPWD, who became our research partner on this process. We had an informal ethics committee set up within the RSH, which was made up of a number of our consortium partners, and they really guided and supported us with the design and the process for this research. The inception report and research protocol were then developed, and we submitted the research protocol to the National Health Research Ethics Committee of Nigeria and received ethical approval in November of last year. We then went through a process of training the researchers and did a pilot in FCT of the research tools, and then the research conducted in 6 states. We had a number of validation meetings with the state coordinators, and then research is being disseminated and shared. And that's essentially the process that we're moving through right now. And next slide. Before I hand over to Deji to talk through the actual findings of the research, I just wanted to acknowledge the number of people and time and commitment that have gone into developing this research. So the 6 research teams in Anambra, Delta, FCT, Gombe, Kebbi, Lagos, and Nasarawa that were brought together by JONAPWD. We spoke to 40 organisations of persons with disabilities in each of those states. And also our informal ethics committee, which was made up of members from Disability Rights Fund, of which Theo is on the call and is going to share some reflections, Sightsavers UK and Nigeria, Options Nigeria, FCDO, and RSH Nigeria. So just to acknowledge everybody's support. And now I'm going to hand over to Deji for the findings. Thank you.
Thank you, Joe, for kicking us off with setting that foundation. Allow me to please acknowledge that, we do have with us today the president of JONAPWD, Mr. Abdullahi Usman Aliyu. We welcome you warmly alongside all our other esteemed participants. And now over to Deji.
Thank you so much, Joe and Dr. Eleanor. So very quickly, I will be running through the summary of research findings and recommendations. In terms of methodology, the research is purely qualitative with key informant interviews and focus group discussions conducted with staff and volunteers of 40 OPDs and OFPDs selected across the 6 geopolitical zones of Nigeria. Specific states were Lagos, Anambra, Delta, Kebbi, Gombe, Nasarawa, and the Federal Capital Territory. In all, we had conducted 40 focus group discussion, 40 key informant interview and 9 focus group discussions with 115 participants in all. Within the context of this research, we have conceptualized OPDs in 2 strands: organizations of persons with disabilities and organizations for persons with disabilities. And for the former, these OPDs that have standalone thematic cluster engagement in terms of relationship with the umbrella body, National Association of Persons with Disabilities, a specific mention of National Association of the Blind, of the Deaf, and then the physical disabilities and all other clusters. And then for organization for persons with disabilities, there are CSOs, OPDs working on issues relating to both persons with disabilities and non-persons with disabilities. Broadly, examples, we have Fast Safe She Rights, Inclusive Friends. They have broader cluster focus in terms of disability strands. And in going straight on to the research objectives, we wanted to find out to what extent OPDs understand key safeguarding concepts and terminologies. And across all OPDs and OFPDs participating in this study, broadly, there is limited understanding of the key concept of safeguarding and what needs to be in place to keep people safe. Of course, these conditions are more prevalent in OPDs than OFPDs. Some OFPDs have some form of systems in place. However, broadly, in terms of language used to describe safeguarding, the disability community understands and relates safeguarding with the term protection broadly. And that's one finding across that. The understanding safeguarding concept is very, very limited across OPDs. In terms of research question 2, we wanted to find out what OPDs are doing to protect people from abuse and harm, and what approaches they have in place to ensure safe programming. Well, there are some examples of safeguarding mechanisms in place in some OPDs and OFPDs, but then some of these processes are not well documented and not operationalized. Again, safeguarding policies that existed in some of the OPDs and OFPDs appear to have been developed as a response to donor requirements. So when donors require a safeguarding policy for OPDs to be funded, they are developed as a response. Though some OPDs, OFPDs mentioned to have received some technical supports to institute safeguarding mechanisms within their organization, some specific mentions around disability right fund supporting, providing technical support, Christian Blind Missions, Site Savers, NDI, CCD, Lady Fatima. But then in terms of reporting, reporting safeguarding seems to be very external to the OPDs. Most OPDs prefer to report to the police, the Human Rights Commission, and all of the likes. But then this study found out some good practices that exist in some OPDs, OFPDs, in terms of safeguarding mechanisms and approaches, and that was shared by some of the key informant interviews. Some of them, the Purple Corner, a place to report safeguarding concerns, the disability community cycle, some practices around toll-free lines for reporting incidences, naming and shaming, and a host of other practices. In terms of the challenges that OPDs are facing, we wanted to understand what broad challenges OPDs or OFPDs are facing in implementing safeguarding mechanisms, and some of the topical challenges were issues around limited understanding, inadequate understanding of safeguarding concepts, of course, which puts the organization in a very constrained place to operationalize safeguarding in terms of to respond to safeguarding risk. Again, there's inadequate funding to operationalize safeguarding mechanisms in OPDs, huge capacity gaps. There's the report of a lack of capacity and knowledge around safeguarding, exacerbated by language and literacy barriers. So some of the terminologies and concepts are very technical for the community, and they are not able to understand this. Again, there's broadly stigma against people with disabilities. Well, this is not the primary focus of this research, but then stigma came up as in almost all focus group discussions and KIIs as a key challenge. We also found out that some donor requirements and compliance processes related to safeguarding appear to amper the OPD efforts to contextualize safeguarding response across the disability clusters. So in terms of tailored safeguarding mechanisms that address the issues of each of the disability clusters. Some donor compliance requisites do not provide ambience for that. We wanted to find out how far do organizations understand and apply good practices that are set out in national and international safeguarding standards. And this study found little evidence of understanding and application of international safeguarding standards. We were also able to deduce that there could maybe have been limited efforts to domesticate this international framework. So there were specific mentions of some frameworks, UN Secretary General's Bulletin, the International Safeguarding on Child Rights, CEDAW, and some national ones, the Disability Act, the VAP had, for broadly there is limited on that, little evidence to show the operationalization of the standard. In terms of some cluster level findings as disabilities cluster specific, we found out that incidences of fake news in social media affect the deaf the most, as they rely more on social media for the primary source of information. So any skewed news on the social media misinforms the deaf cluster. Of course, the blind report experience more verbal abuse and discrimination. Inaccessible structures are more likely, again, to affect persons with physical disabilities. Of course, these are some of the context issues that we found out. Sexual abuse among persons with intellectual disabilities are more frequent. And of course, within that cluster, it is more difficult to report incidences by them, or people probably do not believe them when that is reported. There are high level discrimination in job placements across all disability clusters, but we found out that the leprosy cluster face the highest level of work discrimination, the IDA cluster. Membership of the Spina Bifida and Hydrocephalus Association of Nigeria, SPIBAN, are mostly parents and caregivers, as most of the children are not able to really address or speak about their concerns. Disability and poverty deepen discrimination and abuse of women with disabilities. Those are two evident factors that further exacerbate discrimination, particularly for women with disabilities. Again, in terms of gender-specific findings, we found out that women with disabilities experience high-level domestic violence, often perpetuated by men who do not have disabilities, but are their spouses, because they say they are doing them a favor by marrying them in the first place. We also found out that less educated women with disabilities are more vulnerable to spousal abuse and violence and discrimination in marriage. Some of these spousal challenges in gender imbalances also played out very strongly as some concerns around safeguarding in homes. Women with physical disability experience sexual violence as a result of false or dishonest marriage proposals. Some of them have been deceived into marriage proposals, and then at the end of it, they are sexually abused and then harassed. And this one is quite interesting for us. But there are some traditional mythologies that women with albinism may face sexual harassment due to traditional beliefs that having sex with a woman with albinism will cure all diseases. And some findings that also jumped out at us in the course of our research. In terms of recommendation, this study recommends that the language used to describe safeguarding concepts and approaches needs to be produced in more accessible formats, and then to engender better understanding within the communities using them. Cluster tailored safeguarding concepts that is well understood by the community. Again, there's need to prioritize and fund support for the operationalization of safeguarding systems alongside policy development for OPDs and OFPDs, particularly ensuring disability-sensitive technical safeguarding support is provided. Again, there's need for increased awareness on international safeguarding standards, some strategic engagement to ensure domestication of this international safeguarding standards, and then greater integration of the national policy framework into OPD approach to safeguarding. Of course, one of the very strongest recommendations here is to commission further researches. Of course, there were some good practices that we found out. The purple corner, there's a need to deepen further research on the purple corner, the disability community cycle, use of radio media to name and shame. We also found out that there are some high-level staff attrition in OPDs, OFPDs. And again, in terms of gender sensitive analysis, there's need to conduct more researches in that area. Specifically, this study found out that there were some different levels of understandings between the female-led OPDs and the male-led OPD. However, the relatively small scale of this study means that there's limited data to draw substantial conclusions. I'll stop at this and invite my colleague that led the research in Gombe State to provide some insight. Thank you for listening.
Thank you very much indeed, Deji. Truly illuminating presentation there, and pointing us to the fact that OPDs are not homogeneous, and the details of cluster specific or disaggregated data, the good practices have been highlighted, and most importantly, recommendations. And it gives me great pleasure to now invite Ishaku Adamu and to remind our participants that we do have a Q&A function. Thank you to those who have posted questions already, but please do post your questions in the Q&A function. Over to Ishaku.
Yes, good afternoon, everybody. Thank you for the opportunity. As already mentioned, my name is Ishaku Adamu. I am one of the researchers that participate in these great projects and research from Gombe State. And what I'm going to do this afternoon is to share more insights from the finding, what we have found out from Gombe State during this interesting research. And I'm not going to talk about the methodology being used. I think that has been discussed earlier, I think by Joe. So my own task is only to share more insight into the finding from Gombe State. And I'm going to do just that in a few minutes. The research we did, we conducted, we engaged about 5 OPDs in Gombe State. And most of the findings are quite interesting and quite revealing to most of us during the research. So number one, we found out that there is limited understanding of what safeguarding means, particularly from the technical point of view of safeguarding among all the OPDs here in Gombe State. They seem to understand safeguarding from means saving or security aspect or something that has to do outside the organization, but not within the system of that particular organization. So the understanding of safeguarding in terms of its meanings within the international best practices is quite limited within those OPDs where the research has been conducted here in Gombe State. And also, we found out that there is high incidence of rape, discrimination, and abuse perpetrated by some youth group popularly known as Nkalare here in Gombe State. Those youths are found to be taking drugs and they are roaming around the street, particularly during high political activities, and they can molest any person, particularly women, and more also women with disability. So the fear has been expressed also during that research. And also another interesting finding is that none of the OPDs that we have conducted research on that have a policy on safeguarding here in Gombe State. And they don't have any code of conduct document that talks about safeguarding. Don't talk about anything around focal person on safeguarding issue within that particular organization. So everything about safeguarding is virtually absent within such organization. Also, reporting mechanism within such organization is not well spelled out. Most of these OPDs, when asked if there is incident of safeguarding issue or issue of abuse or harassment, how are they going to resolve it? Most of them, the answer they give to us is that they normally report it to the head of the organization. And we ask them questions like, what about if the head is also involved in that particular abuse? And most of the heads, their answers is that, God forbid, they are not going to do that. So they do not seem to understand that it's about the system, but not about the individual person. So the reporting mechanism is that when they report it to the head of the organization, either CEO or the chairman in terms of the clusters, he's going to invite some elders within the community to discuss about it. If it is something that they are going to resolve, then they resolve it. Mostly this resolve is like pleading with the victim to forget or to forgive. So there is mostly no issue or no action taken against the perpetrator in that particular act. So, and if it is beyond their power, they normally report it to either the police or the Ministry of Justice, which they said they have a strong link here in Gombe State. And also the head of the organizations, they also collaborate, they have link, as I've said earlier, with the police. So if there is any issue, they can easily get in touch with them to discuss. But in terms of building the system to have that safeguarding culture is virtually absent within the organization. The OPDs also talk about issue around inability to pass the State Disability Act within the state, which to them, they said hamper seriously around advocacy issues and their engagement with government, because there is no substantive budget allocation to disability issues, and also engagement with government is quite limited because they lack representation within the government cycle. So these are few findings we found from Gombe State, and I will be happy to answer any question if there is around this interesting and revealing finding. Thank you.
Thank you, Ishaku. Indeed, interesting and quite revealing. And at this point, I would like to invite Theo Odaudu to please make his presentation. Over to you, Theo.
Thank you very much, Doctor. I'm very happy to be given this opportunity to share reflections from the perspective of the Disability Rights Fund as a donor who has been supporting organizations of persons with disabilities in Nigeria. I would like to first of all thank the researchers for the detailed research and for all the findings that have come out as a result of this research, which would be very helpful for us as Disability Rights Fund, and I guess for many other development partners that do provide support to organizations of persons with disabilities. In sharing my reflections on the findings, I'll be speaking generally on some of the issues that came out in the recommendation, and by sharing what we do in the Disability Rights Fund as it regards safeguarding with OPDs and areas of challenges, and what we also think can be done moving forward, and how this research also have brought out some of those things that could help us as an organization. So in the Disability Rights Fund, we have a full set of safeguarding policies, such as the child protection policy, the policy preventing sexual exploitation, abuse, and harassment. We have whistleblower protection, conflict of interest, and we also have the safeguarding protocols that assign roles within the organization, how this can be reported. We have also led multi-agency investigation of investigating abuse, and we have a risk management team that meet regularly to review reports of abuse. Now, as a donor, we require that our grantees develop safeguarding policies. Initially, it began with the child protection policy, but with last year, we made it a requirement for all grantees to develop child protection policy and policy on sexual exploitation, abuse, and harassment. So what we do, we require that grantees sign that they have these policies or commit to developing these policies. And it comes with code of conduct. We have a checklist that grantees have to check that their policies have complied with, and also that the announcement for developing such policies have been shared across all levels of the organization. And the idea is to ensure that everyone in the organization is aware that such a policy exists in the organization, and it is supposed to have a reporting mechanism in place. That's a very key part of the safeguarding policy. We tried for our grantees to also know that safeguarding is internal to them, and the report is supposed to have a strata within the organization where people are supposed to report whenever they feel unsafe within the organization. We also, just like the research has brought out, that organizations of persons with disabilities may not have a deep understanding of safeguarding practices and principles. And as a result of this, we have in place our OPD strengthening component of our grant to grantees, where they can use to develop their knowledge in this area. And the OPD strengthening is to provide more understanding, to guide understanding and implementation. So if you have these policies, you get the OPD strengthening grant to be able to develop implementation guidelines, to update your policies where necessary. And even if you don't have such policy, we provide this grant so that you're also able to come up with such policies. We try as much as possible to allow the grantees consult with people, consultants, and experts that will guide them in doing this, so that it comes out as part of their own policies and not just what we want them to do. Even though often one of the issues that we find is that a lot of grantees and OPDs go ahead and adopt existing policies and just change what needed to be changed, and most of the time, the aim of having them also localize these policies are defeated. And that is why we have a continuous process where we provide trainings to grantees through our grantee convening, through our regular webinars with grantees, to ensure that they are able to internalize these policies. However, I agree that a lot still has to be done to ensure that grantees are able to localize safeguarding principles and practices, and that these policies are owned by the grantees themselves. And that is a cause to which we are committed and will keep pushing. Like I said, we have regular training, and this is ongoing, and how we can ensure that they own these policies. as it's required to be announced to stakeholders that this policy exists, is a way to ensure that OPDs who are grantees own these policies, that their staff are able to also understand the existence or the meaning of these policies, how it is implemented, the protocols, and all that is there. We've had instances where reports have come in because we also require that where such issues arise, grantees also inform DRF about it, and we provide support with investigation and try to also get the OPDs to take action to ensure that redress is sought. Where grantee does not have the safeguarding policy, we still provide grants for them, but we'll do this in 2 tranches, requiring that the policies are developed before the second tranche is got. So like I said, this research is very important to us as donors. It brought out a lot of other things that we probably do not know about these grantees, and that also further strengthen our resolve to try to get our grantees to know more about safeguarding and how it applies. And this is not just for the top ranking officers of organization, but more efforts should be put in place to ensure that everyone in the organization, from the executive director down to anyone at the bottom of the cadre, is also able to internalize these principles and understand the reporting mechanism and feel safe to report abuse. So again, I want to thank RSH and thank JONAPWD and everyone who has been involved in this process. Thank you very much.
Thank you very much, Theo. Great to hear the donor perspective there and the high level of commitment. We will hear briefly now from Mr. Chidi Owaje, please. Chidi,
yeah, our president, Mr. Abdullahi Usman Aliyu, who will speak on behalf of JONAPWD. Can we call on him, please?
Thank you very much indeed. Whilst we're organizing that, we do have some questions from our attendees. I'll take the first one from an anonymous attendee that says, thank you for this presentation. Can you share a scenario of poor safeguarding practice affecting PWDs in the OPDs assessed? I noticed that most of the cluster findings presented focuses on protection issues / concerns. Is this as a result of the limited understanding of safeguarding in OPDs? Maybe
Okay.
Theo, can you take that? Whilst I request kindly to see if we'll be able to get the president to speak. Thank you.
Okay, Dr. Eleno, let me just quickly respond to that. This is Deji speaking. Yes, limited understanding, that is the first thing. But then there are just impressionistic codes that OPDs believe is a response to some of the safeguarding concerns that may occur. So I give you some good examples, some bad practices. Some OPDs invite some able-bodied boys around the street to support them if there's any assault on themselves or their organizations. So they say, like, as at now, the area is safe. If not, if you want to go there, there's a question of me asking or phoning some boys to come down. We do a lot of engagement with them. That's a direct quote from a key informant interview. Another one is saying, no policy in place. Our eyes is our code. Our ears is our code. We just see something and say something. You know, that tells you that there are really very limited understanding on issues of safeguarding, and OPDs and persons with disabilities may have more understanding around protection. And we had presented earlier to say that the disability community generally understands protection, understand safeguarding as protection. So I hope that responds to your question. Thank you.
Thank you very much. I'll go ahead to take very quickly in our limited time the rest of the questions. We do have another question asking for whether both deaf and intellectual clusters are highly affected, but how to minimize their challenges. Most of the problems described in the research without awareness of deaf and intellectual, you cannot meet the inclusiveness and protect them. We also have, and it can be taken together by any of our panelists, we say we need more research. Are there some examples of reporting mechanisms for diverse persons with disability, and which ones are recommendable? So that's a double-barreled two-in-one there.
Okay, maybe I should quickly respond to the last one first. In terms of the good practices, yes, there are some evidence to show that there are some good practices in place. We had mentioned the Purple Corner, the community disability, community cycles, throw-free lines, and all, what have you. But then we have requested that we further interrogate these mechanisms to be sure that there are really measures to protect people from harm within OPDs and OFPDs. And that's why we need to further interrogate that. In the course of this research, we just was able to articulate some of these good practices, but then it requires further researches into that area. I don't know if Phil would love to respond to the question around disability, intellectual disability and the deaf.
If I may say something on that, Deji, I think deaf and the intellectual are factored into the research by JONAPWD, having been one of the critical and important cluster within JONAPWD, and understanding the fact that promoting inclusion require carrying everybody along, particularly for the intellectual disability that is just coming up. And I think they are included. Here in Gombe State, I know we included deaf cluster and they participated actively in both the key informant interview and the focus group discussion. Though we here in Gombe State, we haven't included those with intellectual disability, but I know in other states that has been done for the research. So inclusiveness is what I think JONAPWD always promote, and then try to everything possible to include those particular group or cluster into this research to understand their perspective on safeguarding and also to ensure that inclusiveness. Thank you.
And we have a question from Ntombifuthi Dennis. Says, thank you for an informative presentation on the issue of donor funding. That makes it difficult for OPDs to contextualize their PSCA work. Could you give examples of the kinds of policy clauses or donor requirements that impede this work? And are there recommendations that came from consultations on how this can be addressed or avoided?
Maybe
this is for Theo. I guess this is for Theo because it's directly on donor funding. Are you there, Theo?
Okay. Yeah. Thank you very much. I was thinking that's a DG question, but because the research did brought out a finding that donor funding and donor requirement does impede the localization of safeguarding principles and practices. So what I can just say to that question is that if there is a donor requirement that does not also support the organization to be able to internalize these policies and principles, it does not provide additional support for them to sustain the necessary structure to maintain a good safeguarding system, then such requirement from the donor will only serve to enable the organization develop these policies just to tick the box that is needed to acquire funding. So good practice for me will be that the donor is able to also support these organizations having developed the policy with additional funding on a regular basis to maintain those structures that are needed to operationalize the safeguarding policies that have been developed, and also to always engage regularly with webinars, with trainings, connect them with subject matter experts that will also be the ones implementing this policy as opposed to be implemented by the various organizations. But due to capacity gap, sometimes that does not happen. And so the target for the donor should be to constantly engage with this organization in ways that could help them understand the concept better and implement the principles to the benefit of all the members of the organizations. Thank you.
Thanks very much indeed. I see that we've been able to have the president of JONAPWD to say a few words to us. Are you able to unmute your microphone, please, Mr. Abdullahi Usman Aliyu?
Yeah. Hello?
Yes.
Yeah. Good afternoon, all.
Yes. Good afternoon. You have 2 minutes, please.
Okay, thank you so much. Good afternoon, everybody. The 2-minute mission, I think I have a presentation which I will change to play it off so that I will summarize it as you said in 2 minutes. That's great. The Joint National Association of Persons with Disability, our report dissemination, boldly, I mean widely, lightly, the Joint National Association of Persons with Disability should deliberately disseminating the research report, leveraging on its network across the 32 states and the state capital. In short, what I mean is, it is now our responsibility to make sure that we take this report to all the 36 states we have in Nigeria, plus the Federal Capital Territory of Nigeria. And in addition to that, we shall deliberate on the current national and state level activities. We are already controlling the state and the national activity, well amplifying the lesson learned through the print and electronic media, as well as social media. Secondly, a specific implication for the POSA. We have almost 6 objectives for the POSA. Number 1, JONA should explore partnership opportunity and collaboration for the provision of the technical and the funding support toward the organization of the safeguarding process in organization of persons with disability, stroke organization for persons with disability as an organizational culture, simplification of the safeguarding term in disability friendly format, safeguarding policy, focal person, and the reporting mechanism.
Thank you so very much. I do fear that I will have to interrupt you, President, so that we take the last question and we are able to close the webinar ahead of time. The last question.
Thank you so much.
Thank you very much, President. And the last question is on how organizations, OPDs in Nigeria are keeping people safe, is the title of this webinar. But it seems that OPDs have limited understanding of safeguarding and there's been limited implementation of approaches. Can any of the panelists elaborate on what JONAPWD as a leading national umbrella organization is doing? And thankfully, the president has just given us an insight. So at this point, our esteemed panelists, and I thank them most sincerely for their reflections, their practical applications of disability inclusion in safeguarding practices. Thank you to our esteemed participants who put their questions in the chat. Thank you, Joe, Deji, Ishak, Theo, and President of JONAPWD, Mr. Abdullahi. That's about all we have time for today. And we will shortly be sharing a poll with you. It's got just 3 questions, and we would greatly appreciate if you could complete it. What this poll does is it helps us to tailor our services to suit you and to continue to improve on the events that we deliver. We will be sharing the webinar recording and slides to you shortly, as well as other related resources. If you want to hear about further RSH webinars, I invite you to please subscribe to our newsletter. We're going to be putting the link in the chat. Now, for a comprehensive guide to implementing safeguarding, do visit the Resource and Support Hub landing page, and then you can continue the discussions that we have started today. You will also find that link in the chat. For those whose questions we didn't get to or were not fully answered, please do continue the engagement online. We should have completed the poll by now, and it's left for me to thank some other members of the RSH team, including Sylvia Walker. I introduced Joe Dempster in the beginning, Oge Chukwudozie, and we hope to connect with you again soon. Please do take note of some of the resources. The links are in the chat. And I have said, as I said earlier, please do go to the website. Let's continue the conversation. Every single one of the presentations today will be shared with you for as long as you registered with us. All the very best, and bye for now.